Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Thursday, February 4th, and this is our COVID briefing. We have had 7,771 cumulative positive cases of COVID in Missoula County to date, with 20 new cases since yesterday. We've had 82 deaths associated with COVID-19, and 9 Missoula County residents and 8 out-of-county residents remain hospitalized in Missoula County. We currently have 194 active COVID-19 cases, and those active cases and their identified close contacts remain in isolation and quarantine and are being supported as needed. Our current average incidence per 100,000 people has dropped again to 22. We've now seen that number remain below the goal of 25 per 100,000 for a few days. Remember that all of these numbers, as well as graphs and figures associated, are on our website at missoulainfo.com. The state of Montana is reporting 95,111 cumulative COVID cases, which is up 313 new cases since yesterday. There are now 3,401 active cases with 115 active hospitalizations across the state. There have been 1,308 deaths related to COVID-19 statewide. The University of Montana has had 613 cumulative UM-associated cases since the beginning of fall semester back in August, with 1 new case reported since yesterday. There are currently 12 active UM-associated cases. First, I want to let you know that if our 7-day average incidence of new cases remains below 25 per 100,000 for 2 weeks, the Board of Health will be re-examining the current restrictions that are in place. The Board of Health will be meeting 2 weeks from today on February 18th and may revisit the restrictions at that meeting depending on if our numbers remain low. Next, I want to let you know that there will be a vaccination clinic this Sunday at the University of Montana for those who are enrolled tribal members, persons of color, and people age 70 or older. I was just notified that the clinic is full, and actually the appointments filled up in the first 5 minutes that the scheduling went online. You can get more information and the link to the scheduling appointments for upcoming clinics at covid19.missoula.co. I was also just notified that we had an overwhelming number of calls in to 258 Info today, and it sounds like it took out our entire phone system. They're actively troubleshooting the system right now and hope to get those lines back up and running again shortly. So thanks for your patience while we try and get that sorted out. Across the state, vaccination efforts have resulted in 122,503 doses of vaccine being administered to date, with 32,031 people having received both the first dose of vaccine as well as that booster dose. Here in Missoula County, 12,911 doses have been administered, with 3,645 people being fully immunized with both doses. We're hopeful that we'll begin to see an increase in the amount of vaccine allocated to Montana and to Missoula County. Currently, Missoula County, which means all providers in Missoula County combined, is receiving between 1,200 and 1,500 doses of vaccine per week. So thank you for your patience as we move forward at a pace that is much slower than any of us would like due to the low number of vaccines that we are receiving. The last thing I'd like to touch on today is vaccine side effects. You will hear the terms adverse vaccine reaction and vaccine side effects, so I just want to clarify those for you. When we're referring to adverse vaccine reactions, we're actually talking about a fairly rapid reaction to the dose of vaccine where the person receiving the vaccine may experience an allergic reaction to one or more of the components of the vaccine, and it can cause things like hives and anaphylaxis. When we talk about vaccine side effects, these are symptoms that can appear anytime from immediately after receiving the vaccine to up to a week or so after receiving the vaccine. These are symptoms that were identified during the clinical trials of the vaccine and are expected to happen much more frequently than allergic reactions or adverse reactions. For the COVID-19 vaccines that are available, these side effects can include redness and swelling at the injection site, fever, fatigue, chills, and headache. It's important to note that it is much more common to have these side effects after that second dose of COVID vaccine, but some people may experience these symptoms after the first dose. While it may be uncomfortable for a few days after vaccination, it is a normal immune system response to the vaccine, and it does not mean that you're getting the virus from the vaccine. It just means that your immune system is responding in the way that you want it to, so that if you encounter the virus in the future, your body will recognize it and will be better equipped to protect you. So for more information about the COVID vaccine and answers to frequently asked questions, please go to our website at missoulainfo.com. And again, for finding out about upcoming clinics, please see covid19.missoula.co. And we do have a link to that on missoulainfo.com as well. So that is it for my briefing for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CINDYFARR. Click that notification bell so you get notified when additional videos are uploaded. You can call 258-INFO. We are working to get those phone lines back up and running again. If you have questions about vaccine or questions about COVID in general, or you would like to schedule a COVID-19 test, you can follow us on Facebook at the Missoula City County Health Department's Facebook page. And again, check out our website, missoulainfo.com. And so until next week, everybody, stay warm and stay healthy.